Hello, today I want to talk about the healthcare market, and I specifically want to get into the whys and hows of big box retailers like Walmart and Dollar General getting into healthcare. This seems strange on the surface. So, what am I talking about here? Well, turns out in September of 2019, Walmart started opening these Walmart Health Centers. So, these are primary care centers run by doctors, something I didn't expect Walmart to do. We also see July 2021, they're saying, hey, we have our own insulin drug that's going to be sold exclusively at Walmart stores. This is made by Novo Nordisk, but it is only for a Walmart. They have their own particular generic drug. And we see Dollar General, like Dollar General. I never thought Dollar General at all as a healthcare center. What's going on here? Well, it turns out they just hired Dr. Albert Wu as their chief medical officer. And Dr. Wu, I behoove you, please get in touch with me. If we can find a way to get in the same place at the same time, I will take your picture for free. And I promise you, you and not your background will be in focus. But what's going on here? Dollar General is trying to turn itself into a health destination, which is pretty ambitious given what that store represents to me and others. So maybe there's something more going on here. Well, turns out that in the United States, there have been tons of rural hospitals closing. To date, 106 rural hospitals have closed since 2010. A further 673 of them are in danger or vulnerable to closing. Now, we see on the map here that this is taking place primarily in this area of the United States, and it's a direct ramification of the failure to expand Medicaid in those areas. So keep that in mind. Also, Dollar General, to go back to them, like why them? Well, turns out 75% of the US population lives within 5 miles of a Dollar General store. Now, I personally don't recall going to a Dollar General store, but I looked on the map and it turns out, yes, I am 3.9 miles away from the nearest Dollar General store. From the Walmart perspective, they're thinking that during COVID, they just saw a dramatic decline in retail foot traffic. The idea here is if we have well centers, primary clinics that are all in the same place, that would help bring in foot traffic to their what we think of as the normal part of Walmart businesses. That's what is going on here. That's it for today. Thank you so much. Happy trading as always. I'm Brian Kozlowski.